Yeah, it's a delight to be here. If you didn't understand all of this stuff, don't pay attention to it. In fact, what I do on an everyday basis is teach people how to be better capitalists. So I actually really enjoy this project because it makes me feel like I'm actually contributing something to it. I'm going to be discussing a study that we've been running, and apologies, I have notes, but pregnancy has caught up with me in the last couple of weeks and it's made me, let's say, forgetful, if not stupid. So we're going to be discussing, I'm going to be presenting a study that we're doing here at Macquarie University, and it's a collaboration between the Australian School of Advanced Medicine and our Faculty of Business and Economics. The research team, I hope I haven't forgotten anyone, is quite large. And what we wanted to examine is what is the impact that lymphedema has on individuals after they go back to work, and also in their home lives and their work lives, and start gathering some data about money and how much it costs to live with this condition long term. So we structured this in a two-phase study. First, we said we're going to interview some people to get stories, their stories, and then we're going to go into a national quantitative study. And today I'm going to be talking about the qualitative, the interviews that we did. We actually got ethics for the quantitative, the national study that John talked about at about 2:30 this afternoon, so I'm very happy. Yeah. So why did we do qualitative research to begin with? We wanted, as I said before, to get stories from the horse's mouth, if that's the easiest way to understand. We interviewed 20 individuals who live with lymphedema. The interviews lasted for about anything from 30 minutes to an hour and a half, and were conducted by that wonderfully handsome South American gentleman who's pretending not to look at me, Hector, who did most of the interviews. I only did about 5 with him. And we recruited the interviews through here and through Wiga Hospital and also Louise's practice. And we analyze interviews using a program called Interviewees. And these are the findings, initial findings of our study in terms of categories. And let me tell you that these are very initial words that we're using. We're actually going to revise this as we go along, and we are now in the write-up phase of this project. So I'll begin with treatment, and there's quotes here from different participants you can read while I talk. Difficulty in getting a confirmed diagnosis of lymphedema was a source of frustration for a lot of our interviewees. We find it problematic that GPs in Australia are actually quite unaware of what is going on and are unable to give consistent advice about how to manage it. And what I was talking to Jared with earlier during the break is that these people that we interviewed are based in Sydney. So my question is, what happens in areas that are rural? So where do these people get information? And that might be something that we need to consider in how we structure future research. Interviewees reported instances of frustration, as I said, because not only they couldn't get treatment, they couldn't get advice to how to get treatment, but also because there was lack of awareness, in particular about the complexity of the condition and how it affects everyday life. And so from the treatment category, I think there is a need, and I'm not a doctor at all, to educate medical practitioners in Australia about lymphedema. How can people manage it? How can, and where do you send the patients for support networks in Australia? Another interesting area of training that you might want to consider, given that you are in the area, might be a little bit of bedside manner training. I mean, I was not particularly impressed with the second quote of the lady. So, how do you deliver news about how to manage this, and what kind of emotional support can a practitioner give to individuals who have been diagnosed with this and how to manage it? So, in terms of social impact, our findings confirm very much Sheila's research overseas. So, emotional distress is caused by strangers staring and by strangers asking intrusive questions. My favorite quote from the data, and it was one of the interviews that Hector and I did together, was a lady who mentioned that every time someone asks her about her lymphedema, she mentions it's a shark bite because she didn't want to discuss it with anyone. And it becomes even more interesting in my mind when we consider that that particular lady was a very conscious, non-compliant patient. She did not want to wear her garment. So I think it was kind of a denial phase still in her life. So for our interviewees, particularly the warmer months, summer months, are particularly difficult to navigate because they don't want to wear the garment, not only because it's hot, but because they can't hide it either during the summer months. And it appears as a constant cancer reminder, which is a very common finding in the literature so far. For me, what popped out in particular from our interviews was that it's not only a cancer reminder for the individual themselves, but it's also for their families. So with this, the second quote here, we had, when people were talking about their cancer and when the lymphedema brought up memories about their cancer, this is where people got emotional in our interviews. So with this particular lady here, we had to stop the interview or to pause the interview for a little bit when she was talking about her children, how difficult it is for them to see her struggle to clean the windows. I think it was the story that she was telling us about. And I think this is something that we need to kind of emphasize in the literature, that it's a cancer reminder not only for the person, but also for the family. So how do we support the family in that, to that end? Also, the demand of self-care take up a lot of time. People don't want to give the time. And some women chose isolation than actually going into social gatherings or doing their usual leisure activities that they participated in. We unfortunately have stories of individuals who report significant distress because their family is not supportive as they would like them to be. So again, the significance of partners in particular, not necessarily only children, but husbands, wives, boyfriends, girlfriends, partners in general comes to the fore for us in terms of what we found from the interviews. Again, body image. Most of our interviewees have had a negative image of their body, and that is, as we see it, is a combination of what they think of themselves, but also it's made worse by people staring and by people asking questions. So their body identity is kind of, it's a complex relationship between what I think of myself and what others think of me. And yeah, so the words that we have in our interviews are ugly, they're fat, especially when people can't wear the clothes that they want to wear, they can't find the clothes that they want to wear, they constantly have to wear loose clothing. Yeah, and here we wanted to find out what is the impact, as I said before, about work life. And let me preface this by saying that I remember someone asking about work. We would like as much help as possible to recruit patients that are still in the workforce, because we found it a bit harder to find people in the workforce. So on the one hand, we have stories of individuals who have actually had to either change roles or maybe had to change employment to actually be able to deal with lymphedema. But other participants have had very supportive work environments. So our findings are kind of contradictory at this stage, and we really need kind of a bit of help to go one way or the other. Money, which is important. Now, we have initial evidence from this qualitative findings of the project that lymphedema challenges people in their financial lives, and treatment for lymphedema is costly. You will see a couple of quotes here. We are aware that there is the Medicare support for 5 visits to allied practitioners, but that might not necessarily be enough for people to just go to one of you for 5 times in a year. We have come across stories of individuals who have neglected, I guess, their treatment because of financial issues. We have had people who have had to cut down on their social activities. We have had individuals who have had to move to smaller houses because of consistent costs that are associated and the burden of cancer on top of that. So it has been highlighted in the literature before that maybe what could be done is also a long-term research in terms of what are the financial impacts on people who are not compliant for long term. So this might be another option that we need to take. So I've been very quick, as I promised. The second phase of our research is to find 500 individuals who are breast cancer survivors and that have moderate to severe lymphedema without any surgical interventions, and 500 individuals, breast cancer survivors without lymphedema, to act as a control group. Does this have internet? The computer? Do you know?
Yeah.
So this is the, as I said, we got ethics about an hour and a bit ago, which I'm very happy about. The survey will look, we will administer initially set the survey online because it'll be easier for the participants to skip questions if they don't apply to them. So I was hoping that by today we would have had the ethics, and I would have been able to distribute some of our flyers for you to be able to recruit your participants, but I'll just give them to Louise and Louise can give them to you. But this is what it looks like. I'll give you the website as well. And basically they just click next and answer questions and so on and so forth. So any help with recruitment to that end, I would really, the whole team would really appreciate it. So thanks, that's it from us. Any questions to Hector?
Any questions to Hector? Any questions or any comments, any anecdotes regarding work, for example, from therapists?
So I've come across a few ladies with lymphedema working at the tax office.
Oh, wow.
And they have a fairly proactive approach to cope with work.
Yeah.
However, what I have found is that after breast cancer, some of these women have worked so hard to stay at work, to get back to work.
Yeah.
And then, I've had women staying at work all through their entire journey, which I find gobsmacking.
Absolutely.
Maybe their presenteeism is quite significant. Okay. And the employer sees it as, we're supporting this person so well, they've finished their treatment. They should be better now.
Yeah.
So there's a very poor understanding at the end of that sort of 12 months, 18 months period. But some of these ladies then go into a transition of, well, maybe it's time to start thinking about retirement.
Yeah.
So that's my anecdotal experience with some of these working women.
Yeah. Yeah.
But if you want a lot of women, some of the large government departments are really quite proactive and want to be able to see to be helpful.
Okay. Well, thank you for that.
That's a great idea.
That's a great idea, yeah.
We're currently writing a grant for the Cancer Institute of New South Wales. It's part of a research hub grant with the Marto, the Collins Institute, North Shore Hospital here, and part of the grant, if successful, we're writing into it. We want to establish, it's driven here through Macquarie, a learn program, which is Lymphoedema and Education Research Network, to try and bring together therapists, doctors, other health professionals, so we can help recruit the studies, do some joint research, rather than working in isolation, and hopefully 4 times a year contribute to this type of interactive education session with consumer involvement.
And I think we would like to lobby government to increase. That's the whole purpose of this.
Yeah, one of the sort of key initiatives working with our School of Business is to expand this study and look at a group of patients prospectively. We've just the trial Sheila's here to help promote and train our staff and so on, is looking at the 400 patients that Louise mentioned, and we're hoping to bolt on to that a study looking at the impact on work, social life, family life, disposable income, absenteeism, presenteeism. Because as a breast cancer doctor, you sort of, I know my patients are juggling time off work from their breast cancer and then lymphedema, and it's not just the lymphedema, the whole thing is interrelated. And but then you've got another comment?
The comment I have is that in the land of work, there are very few therapists. So the people with the knowledge about lymphedema are in the clinics, and they're not work therapists. The work therapists work in the land. There's no interaction and communication. So, as I say, if you go directly to some of the really large employers of women, there's no therapists that you would normally see in a workshop like this. But you'll come across people that are interested in work health.
Okay, thank you for that. That's very helpful. Absolutely.
I think that the area of work is that there are actually some, for our nurses, a major problem of wearing garments at the hospital.
Yeah, because it's short sleeve,
They're not allowed to, so there are limited problems. But I guess one of the things that really rang true, and I know this is a case study, is last week I saw a lady who has melanoma cancer, and her greatest distress is that of her child, who's 6 years old, and now requiring significant counselling. Not because of the melanoma, but because of the
constant
exposure of her
leg. So I think we could, in whatever we are, kind of highlight that later on.
Sure.
Yeah, I know we're hurried for time, but I would just like to say that if you had done the study in Nashville, Tennessee, you would have found the exact same thing. This is not an Australian-specific set of issues. It's an international problem.
Agreed.
And I think we're going to have to start thinking internationally to be able to answer some of these questions, because this is pervasive everywhere, unfortunately.
Yeah, I was thinking the same, that it might be a good opportunity to compare and highlight how this is happening everywhere. Yeah.